Have you been told that you need to have treatment for your BPH or your benign enlarged prostate? And you've heard of a couple of newer minimally invasive treatments, but you're not sure which way to go. In today's video, I wanted to highlight for you the difference and the similarities between iTind and REZUM as treatment choices for your urinary issues. Although they're both minimally invasive treatment choices, they're very different, certainly in terms of how they affect benefit and the potential side effects. One size doesn't fit all, and just because you want to have a particular treatment, your prostate may not necessarily be amenable to that treatment. Hi, for those of you new to the channel, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic located here on the Gold Coast in Australia. As always, if you get benefit from the video, please give it a thumbs up, subscribe to the channel. In fact, 90% of you that watch our content don't subscribe. If you do like the video, think about subscribing. Otherwise, YouTube are unlikely to recommend another video of ours to you. Okay, let's get into it. Let's start with iTind. iTind, in essence, is a newer treatment, a newer minimally invasive treatment that basically involves the insertion of a three-pronged basket. Think of it like an expanding stent. Now, this is inserted into the prostate for around 5 to 7 days. And during that time, the stent gradually expands and reshapes and remodels the internal aspect of the prostate, opening up the bladder outlet and making the natural channel, the outlet pipe of the bladder, as it passes through the prostate, wider and less obstructed. The basket or the iTind device itself is inserted in Australia under a general anesthetic, and there may be regional variation. So if you're in America, the probability that this may be done under light sedation or in the urologist's office is greater. The basket itself, or the stent, however which you decide to view it, is kept in place for about a week. You go home, you keep it there. You come back a week later, and the urologist then will do another cystoscopy, a camera test, to actually remove the device. As I say, during that week, the device gets bigger, and it actually creates a larger channel inside the prostate. And where there is contact between the device and the prostate, there is scarring that evolves in that area. And the vision is that that scar tissue keeps the outlet pipe open. So what are the key characteristics of iTind? Well, in essence, there's no heat, there's no freezing, there's no ablation of tissue. There's nothing permanent that's actually left in place. The majority of men can experience an improvement in their flow and their urinary symptoms, more broadly speaking, usually within around 2 to 6 weeks. The recovery itself is relatively quick. Men don't like necessarily that week when the stent itself is in place. But the other big benefit of iTind is that there is minimal impact on sexual function, particularly no impact on erectile function and negligible impact on ejaculation. Now, who's ideal for iTind? Well, someone with a smaller prostate, so less than 60 cc's. And to put that into context, I advise men that the standard average size prostate for a man in his 60s is around 30 cc's. There are different shapes of the prostate, and those men that have a median lobe, which is where there's a projection of the prostate actually into the bladder, they're not really a great candidate for iTind, as there still is that mechanical obstruction of that lobe protruding into the bladder. iTind is simple, it's elegant, it's very effective when it's used in the correct situation for the right man with the correct prostatic configuration. Well, what about REZUM? What is REZUM? It's also minimally invasive, but it's completely different in terms of how it affects benefit. In essence, it uses steam-based therapy. Men, certainly in my practice here at the Prostate Clinic, have a general anesthetic, it's done in day surgery, and we place a camera, a cystoscope, through the urethra, up inside the prostate, and then we inject multiple times into the prostate steam in areas where there is overgrown tissue. Now, that heated water vapor basically destroys those cells in that area, and then gradually over the next few months, the body reabsorbs that treated tissue, creating a cavity. opening up a channel, unobstructing the bladder, and causing improvement in urinary symptoms. As I said, certainly in Australia, it's treated or performed under a general anesthetic. In America, it may be performed under a local anesthetic or sedation, certainly in a doctor's office. There are multiple treatments, and on average, I use 5 to 6, and each treatment, each injection, and they're all done in the same treatment episode, but one injection is basically 9 seconds. Now, several weeks of gradual improvement. I say to men, expect no benefit for the first 3 weeks. And for that first 3 weeks, you may actually find that there's a bit more irritation. You go more frequently, you rush to the toilet, you're up at night, and your flow can be weak, in part because of the swelling related to the injection of steam. From 3 weeks, men begin to notice subtle improvements in flow, and there's a gradual, steady improvement out to around 3 months. Now, one of the drawbacks, as I see it with REZUM, is that men need to have a catheter, and that usually is for around 3 to 4 days, but will vary, and there are alternative strategies. But it needs to be, men that go into this process need to be aware that it's a slow, gradual improvement rather than an immediate fix. So what are some of the key characteristics of REZUM? Well, in essence, it's an ablative therapy. It's heat that results in the removal of tissue. And it's more effective for larger prostates. And one of the real advantages, in my opinion, of REZUM is the broader spectrum of shape and size prostate, including those men with median lobes that can be treated with REZUM. So REZUM, basically, it's a powerful way to treat an enlarged prostate that has a scope that is more broad than iTind in and of itself. Now let's look head to head at a variety of different characteristics comparing iTind and REZUM. So let's look at effectiveness. Which one results in more improvement, if you like? Well, iTind gives good outcomes in appropriately selected patients. It works best in smaller prostates without a median lobe. REZUM, however, consistently gives a big improvement across a broader range of shape and size prostates, including those with a problematic median lobe. So in terms of effectiveness, arguably, in my experience, REZUM comes out on top. In terms of durability of outcomes, well, that's a hard one really to draw a head-to-head comparison. iTind has not been around for as long as REZUM. With iTind, we reshape the prostate rather than getting rid of tissue. And with time, it's possible that there can be evolution in the growth of a prostate that re-obstructs the outlet. With REZUM, tissue is actually removed gradually through reabsorption of the treated area and can provide big, durable improvements in men's urinary function. So if we were to look at durability, my feeling is that REZUM is going to come out on top in that regard. Now, what about sexual side effects? Well, this is a big driver when men are looking at the treatment choices for managing urinary issues related to a big prostate. And sexual function really encompasses 2 characteristics. Number 1 is erectile function, and number 2 is ejaculation. Now, neither of these 2 treatments are going to influence erectile function in any way, but they both can have an influence on ejaculation, although with iTind, the probability is remote. With REZUM, one of the challenges that we have with REZUM is that when we treat the median lobe, or if there is apical tissue that's causing obstruction, if there's dissipation and spread of that heat, that thermal energy in and of itself can cause interference with the ejaculatory ducts. But it's also possible that when we remove tissue at the bladder neck, that increases the possibility of retrograde ejaculation. That being said, REZUM versus standard cavitating forms of treatment, such as a green light or a TURP, is far less likely to cause retrograde ejaculation. But men do need to be aware that it is a possibility, even though it's far less common, it is a possibility when dealing with REZUM. So if ejaculation maintenance, if you like, through the process of a treatment is high on your priority, Assuming your prostate characteristics are appropriate, then iTind would come out on top. What about prostate anatomy, suitability? Well, we've kind of alluded to this really. iTind is a little bit more specific, smaller prostate, no median lobe, and REZUM is a bit more adaptable and a bit more versatile in terms of shape and size prostate that's amenable to it. So REZUM would be the winner when we're looking at anatomical suitability. Anesthetic requirements, well, really in Australia, it's a bit of a moot point because either way, we manage these men with a GA in day surgery. Now, if we look at long-term health risk reduction, iTind can remove symptoms, but it doesn't reduce your prostate volume significantly, whereas REZUM will reduce prostate volume. If you've got a question or a comment, or if you've had one of these treatments, please leave it in the comment section down below so that other men can learn from your experience about what you may have gone through. Okay, so let's summarize. Let's bring it all together. Who is suitable for which treatment? So iTind, let's start there. iTind is a better choice if your prostate's less than 60 cc's, there's no median lobe, you really don't want to have a heat-based treatment, the maintenance or preservation of erectile and also ejaculatory function is a priority for you, and you don't want to have a permanent implant left in, which happens with something called urolift, which we haven't discussed today. So those men that end up with iTind tend to be younger men that are sexually active, that want minimal impact on ejaculation, and their prostate characteristics allow them to pursue that particular treatment. REZUM, well, REZUM's going to be better if you've got a prostate volume, roughly speaking, from 30 to 80 cc's, and even if you have a median lobe. If you want a durable, longer-lasting treatment, you want to avoid the impact on erectile dysfunction, you accept that there's around a 5% risk to ejaculatory dysfunction, but you want a long-term durable procedure, then REZUM would be more appropriate for you. Okay, so to summarize, in essence, when we're dealing with BPH or urinary symptoms related to an enlarged prostate, the old paradigm of have a tablet until that doesn't work or your body doesn't tolerate it, and then you go and have a TURP, in my opinion, that is long gone. There are a variety of different treatment choices, including different medications and combinations of medications, as well as minimally invasive treatment choices or more definitive therapies. So it's important to be aware of your choice and the nuance of your prostate characteristics and appreciate that there is always a degree of compromise that is required when you are choosing your definitive therapy. Be aware of your profile so that you make the decision that you think is right for you. As always, please give the video a thumbs up, subscribe to our channel if you'd like to see more about your prostate, have a look at this video here, or alternatively, this video here. If you have a question that you would like to ask, please become a member of our channel. We have a live event that happens the last Thursday of every month, 7:30 p.m. Brisbane time, which is GMT plus 10. If you have a question, become a member and we'll get stuck into it at that time. Until the next time, take care of your prostate.